Hi everyone, welcome back to my channel, Talk with Dr. Frid. Again, I'd like to talk today about some specialty labs that I offer. I did do a video about some PANS and PANDAS labs that I like to order routinely, which can be linked below. But today I'd like to talk a little bit more about the infectious labs that I order, and I like to use a couple of specialty labs. Why do I use specialty labs instead of routine labs that are mainstream? Well, because specifically for some of the infections that I check for, including Lyme, the test is not very sensitive. In fact, there are some studies that say that the test that's routinely available in a mainstream lab can miss 80 out of the 200 patients that you send. So it's not exactly 50%, but pretty close to that we may miss where a patient actually has the infection, however they're testing negative, which, as I often talk about, is a false sense of security both for the physician and of course the patient. So for that specific reason, I actually use specialty labs, and I in fact use a number of them because I find that certain labs are specific and sensitive for a particular infection that I'm looking for, which is why I often send the patient sample to various labs. So one of the common labs that I'll use is IGeneX, and I often order Lyme testing as well as Babesia testing through these labs. I often order the Immunoblot or Western blot for these infections, and for that reason I do not require my patients to come off their antibiotic or antimicrobial therapy during the blood test or right before the blood test. And the reason for that is I'm actually checking with these specific labs patients' immune response to these infections, instead of trying to identify the infections themselves with PCR testing. So if you are ordering a PCR test, then yes, the patient should come off the antibiotics for 1 to 2 weeks, the longer the better, so that you can actually identify the DNA of the infection. However, in the particular test that I order, there's no need to discontinue antibiotic therapy. The other test that I like to use is Galaxy. And this Galaxy test I specifically use to assess for Bartonella, and I often think that Bartonella hensleyi is probably the most virulent out of the Bartonella species, and that test is also an immunoglobulin test, specifically immunofixation assay, which is an IgG test. And for Bartonella specifically, that's an infection that often evades the immune system and often can live intracellularly. So therefore, the immune system has trouble detecting it or showing that it's fighting that infection. And I find the Galaxy test being particularly sensitive in identifying that infection. And so I often use this test if I suspect the patient can have Bartonella. Specifically with Bartonella, patients may present with a lot of neuropsychiatric symptoms, as well as a lot of symptoms of neuropathy, muscle pain, fatigue, and some symptoms that are more constitutional that are not specific for Bartonella, like can cross-react with things like Lyme and Babesia, Ehrlichia, and other co-infections. But the ones that I've listed, I often think of Bartonella, and I typically order that test. More recently, I've been using TLab testing, which actually looks under the microscope for the Bartonella species, again intracellularly, and that test has been developed by a colleague who actually is the medical director for Galaxy, but has developed this test as well. And I find the TLab test, again, very sensitive for Bartonella hensleyi specifically, which again, many of my colleagues who treat tick-borne infections believe that the Bartonella hensleyi is the more virulent out of the Bartonella species, and therefore try to hone in on that particular infection. I think it's very important for this specific infections that I mentioned in this video to identify them, because in a lot of cases it would change your management. It will help to pick the type of antibiotic that a person needs to be on, and the treatment plan in general may change based on the tests that we order here. Also, the reason why specialty labs may be important, and the ones that I mentioned here, is because, as I mentioned earlier in the video, specifically Babesia, Bartonella, and as you heard, even Lyme is not very well detected by routine testing. And so again, to reiterate, I think it gives it a false sense of security to the patient and the doctor when they're testing for that specific test, for that specific infection, and the test comes back negative in the routine lab. I go to the specialty labs to make sure that we're not missing these particular infections, as we of course need to treat them. I hope this helps, and I'll see you back during my next video.